Assalamu alaikum and good morning. I'm Dr. Ayesha Munaf from CMH Lahore, and it is an utmost privilege to be standing here today in front of all the distinguished speakers and doctors. The topic of my research that I would be presenting here today is frailty, hand grip strength, and the predictive laboratory parameters in patients on long-term hemodialysis. This presentation would be incomplete without extending my deepest gratitude to the co-authors, especially my mentor, Colonel Dr. Abdur Rahman, HOD Medicine, Dr. Rizwan Yusuf at CMH Lahore, and my batchmate, Dr. Anika Mushtaq. So, first of all, coming to the introduction. As we all know that end-stage renal disease is a global health challenge, and it affects 12.5 to 29.9% of the Pakistani population, which is a huge number. And out of this percentage, 60 to 97% of this population suffers from underlying frailty, which shows that without any doubt, frailty is the silent enemy of end-stage renal disease. It not only leads to reduced functional capacity, but also to the increased hospitalizations and higher complication risks in the end-stage renal disease patients. Frailty not only increases with the dialysis duration, it is also linked to the muscular atrophy, inflammation, and increased oxidative stress. Currently, there are two available tools to assess frailty. That are the hand grip strength and the short physical performance battery protocol. The purpose of this study was to assess that if there are any laboratory parameters that can be predictive of frailty in individuals undergoing dialysis. We also wanted to assess the available assessment methods and their efficacy in predicting frailty. By exploring this correlation, we hoped to improve the evidence-based patient care and improve the quality of life in the patients who suffer from the deadly disease. This study was carried out at CMH Lahore in months of December and January 2025. We included 105 patients who were diagnosed with the end-stage renal disease who were undergoing maintenance hemodialysis for more than 3 months. The key exclusion criteria, however, include acute kidney injury, reduced functional status, and physical disabilities. There were 3 methodologies that we used in this research. The first one was the hand grip strength. We assessed the hand grip strength using a digital dynamometer, and we took 3 values on each limb. The highest value was recorded. The second methodology that we used in this research was the short physical performance battery protocol. It included the balance test, the gait speed test, and the chair stand tests. In the balance test, there were 3 further tests that were the side-by-side stand, the semi-tandem stand, and the tandem stand, each one for 10 seconds in all the patients. We then carried out the gait speed test, in which we asked all the patients to walk a 4-meter distance, and we recorded the time period for that. After that, we carried out the chair stand test, in which we asked the patient to cross their arms and rise from the sitting position. If the patient was able to do it, we then performed this 5 times, and we recorded the time period for it according to the standard protocol. The third methodology that we used in this research were the laboratory parameters. We assessed 8 laboratory parameters in all the 105 patients that we included in the study. Those laboratory parameters were the hemoglobin levels, bicarbonate levels, CRP, creatinine, calcium, phosphate, albumin, and potassium. SPSS version 24 was used, and logistic regression was applied to identify the predictors of frailty. Coming to the results, the 105 patients that were included had a mean age of 55 years. The hand grip strength was calculated to be 15.11 on the right hand, and it was calculated to be 13.52 kgs on the left hand, with the standard hand grip strength being 14.32 kg, which showed that the stronger hand grip strength correlates to higher short physical performance battery scores. Another important finding of this research was that the hand grip strength of more than 16.95 kg predicts normal physical functioning and a short physical performance battery score of more than 10, with 81% specificity and 65% sensitivity. However, there was no statistically significant association found between the laboratory parameters and frailty in our study. Coming to the discussion, the hand grip strength and short physical performance battery protocol showed a strong positive correlation, reinforcing their role as reliable predictors of frailty. Laboratory parameters, however, did not predict frailty, which aligns with the previous researches which also show mixed results on the biochemical markers. Hand grip strength of more than 16.95 kg corresponds to normal physical function as PPB score of more than 10, and it can be used as a bedside screening tool in the patients who suffer from chronic kidney disease. However, frailty was found to be a multifaceted condition which involves both physical and psychological components, and it requires full clinical assessments rather than depending solely on the lab values. Decreased hand grip strength and by extension low short physical performance battery scores can prove to be, basically they predict poor prognosis in the end-stage renal disease patients. Exercise programs, dietary optimization, and comorbidity management may help in optimizing the health outcomes. There were certain pitfalls that we encountered during the study. The first one, in my opinion, was that the short physical performance battery is observer dependent. So it might introduce certain variability into the results. The second one, in my opinion, is that 105 patients is a little insufficient sample size to draw robust conclusions. While we included 8 standard laboratory parameters in this research, certain novel biomarkers such as homocysteine levels, interleukin levels were missed. They could have predicted frailty. So coming to the conclusion, in my opinion, a 60-second hand squeeze reveals what laboratory parameters often miss in these patients. However, more research is required on the novel biomarkers and the hormonal changes to see if they can predict frailty. An impact of exercise and dietary regimens needs to be further explored on these patients. These were the references that we used in our study, and this is my QR code for the further details on this article. Thank you so much for your patience and attention. Thank you.